International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
I'm Dr. Thow from the University of Sydney in Australia, and this video is a short summary of the commentary that Dr. Deborah Gleeson and I authored in the International Journal of Health Policy and Management in response to Professor von Labonte and colleagues' analysis of the final text of the Trans-Pacific Partnership Agreement and its implications for public health. Now, this analysis reiterates the evidence that's been emerging over the past 10 years for the negative implications of trade agreements for public health, particularly in restricting access to medicines, constraining policy space for public health action, and increasing availability and affordability of unhealthy commodities like alcohol, tobacco, and unhealthy foods. The analysis also highlights that there have been some specific wins for public health, not systemic wins, but specific wins that are really evident in the final text of the Trans-Pacific Partnership Agreement. This includes a carve-out for tobacco, and it also includes limitations on the intellectual property right extensions relevant to medicines, which is positive for increasing access to medicines, particularly in the developing countries involved in the Trans-Pacific Partnership Agreement. However, the final text of the Trans-Pacific Partnership Agreement also highlights overall the fundamental incoherence between trade policy and health policy. So in our commentary, we start to explore some of the changes in the trade policy space which might represent potential windows for public health researchers to start to push a different discourse and support much more coherent policy making. Because the trade policy space is changing significantly, particularly in these last 5 years. We've seen India and South Africa terminate a range of bilateral investment treaties with the specific intention of increasing domestic policy space for social objectives. We've seen the IMF start to reconsider the conception of neoliberalism that's been fundamental to its activities over the last several decades. We've also seen these mega-regional agreements, such as the Trans-Pacific Partnership Agreement, which have been hailed as a way to overcome the stalemate at the World Trade Organization in multilateral negotiations, actually stall. And there seems to be significant doubt as to whether these mega-regional agreements are going to actually move forward. So how can public health researchers take advantage of these potential changes in discourse, changes in policy making at that international economic level? We highlight two key avenues for research which could support changing discourse and support improved coherence at a fundamental level between trade and public health. The first of these is the need for public health researchers to engage specifically with political economy and power. The fact that these agreements, if not explicitly designed, are certainly used by industry to drive specific agendas. And that if we can engage with stakeholder analysis, analyses of power, analyses of the way discourse is used and framing occurs, then we can start to understand ways to create more constructive frames. The second issue is capacity. There is at the moment a lack of capacity among health policymakers to engage with the economic agenda. So public health researchers can play a role in increasing the capacity of public health policymakers to be able to have well thought through negotiating platforms, specific arguments to counter the arguments of vested interests in the trade policy space, and to come up with concrete recommendations that they could move forward with in improving coherence between trade and health policy.